Hello, this is Prakash. In this video, I'm going to give a brief introduction about presenting Journal Club and some guidelines on how to present one. First of all, why evidence-based journal club? And what is the necessity of doing this journal club? One of the major objective of doing a journal club is it will help us to understand about recent developments in our profession, because most often we rely on textbooks, which is often outdated, and so therefore journal clubs are the way to bring recent developments into the curriculum and learning. And also it improves our skills in critically appraising literature, research literature, and more importantly, evidence-based journal clubs encourage debate and use of evidence in making clinical decisions. So how do you prepare for presenting a journal club? You should start preparing at least 2 weeks before your scheduled date. And the first thing that you should do as preparation is to choose a real patient scenario, that is a patient that you have seen during clinical practice or clinical training, and a question that you had while managing that patient. This question can be about treatment, that is, what is the appropriate treatment for that patient, or is a particular treatment is better than the other, and so on. And it can also be about diagnostic test, value of diagnostic test or prognosis. But having treatment as a question would help us, at least during initial stages, to learn better about critically pricing literature. And second thing, once you have identified a real patient scenario, discuss it with your faculty mentor and convert your clinical question into a picker format. And after that, search for evidence, utilize your library resources using online databases, and identify an article, discuss it with your faculty, and see whether the article that you identified is relevant to your patient scenario, so that you can present it for the journal club. Here, in terms of presenting journal club, I have divided the overall presentation to consist of 5 parts. First part is where you introduce yourself to the audience, and you explain why you chose this paper, and summarize the article you selected, critically price it, and then finally conclude what is how your clinical scenario or the question that you had is resolved. What do you think of it? So why you choose this paper? What information that you want to provide to the audience here? First thing, provide your clinical scenario to the audience so that they will understand the context in which your presentation should be looked into, and also explain your clinical question and how you convert it into a picker format, and discuss about what search strategy you developed, keywords used, which database you have searched, and how you find this article. This will help other audience also to understand the entire process, and also when they are in a position to do a journal club, they will also will be able to reproduce it, and so that it helps others too. Then next part of the presentation is where you summarize the article what you have given. And here it should be a brief summary of the article, because presenting an entire article would be time consuming, and also it may not be necessary to present the entire article. So here I have put down the information that you want to provide, you want to include in your summary. First thing, state the objective of this research. That is, why the investigators carried out this research, what question that they have had in their mind. And second, how did they carry out this research, where you discuss about their methods section in terms of study design, group assignment, blinding if it's done or not, intervention provided, at what treatment they provided in each group, and components of the intervention, intensity, dosage, etc. And outcome measures, which outcome measures that they have used, and if they have done a follow-up, what's the different time point of assessment that they have done, and dropouts, the things. And finally, what was the study results that they have found. Here I suggest that when you are describing study results, it's better if you reproduce the tables, results table that they have given, because it's easier for people to understand. And in case if the study result table is exhaustive or there are too many tables, you can modify the table in such a way that you provide all relevant and important information. And also, if they had a graph, if you put it, that's easier to understand the study results rather than putting it in a sentence format. So once you have summarized your study results, your next step is to critique. This is the core area of journal club presentation, where you critique the study to see whether the study has a value worthy of to be considered for clinical practice. Critiquing, again, two parts of the study you have to critique. One is methods, and the second one is the results section. Method section, to critique method section, you can use a Petro scale. I think most of you are familiar with Petro scale, so you know how to score it. If not, you can just log in, browse through the Pedro website, and you can find the Pedro scale. The Pedro score will give us information about the quality of the methods that they have carried out. Greater the score, higher the study quality in terms of bias and the design and other things. Next, you will critique the study results, what they have got. That is, how the authors interpreted the results and what the study results actually mean. So there are three things that you have to look into when it comes to study results. One is statistical significance, and second is clinical significance, and third one is generalization of study results to the population, and to be specific, to your patient. Statistical significance, what information we get out of it is, it basically answers one question, that is, what is the likelihood that the difference observed between two treatments could have arisen by chance. What does this mean? This means that a study that is done in sample, that is, they have done the study in 40 patients or 50 or even 100 patients, and they found the result. So our question is, so if there is another study is done on the similar patient, whether the other study also will provide the same result. And more importantly, if we apply this in our patient, whether we will also get the same result. If a study result did not arise by chance, then the study results can be reproduced by doing another study or while applying to our patient. If the study result has arisen by chance, it may not be able to reproduce when you're doing another study, or when you're applying it in your patient, you may not be able to reproduce the same result. So p-value tells us that what is the chance that it could have arisen by chance. That is, can it be reproduced or not? So arbitrarily 95% was chosen. What it means is, when p-value is less than or equal to 0.05, this means that whatever results that they have got in the study, it did not arise by chance. That is, there is a 95% chance that their study results can be reproduced if you do another study or if you apply it on your patient. So that gives us confidence that the study results are or the real difference. They did not just arise by chance because of sampling errors or so. Next thing is clinical significance. Clinical significance deals with, and it's very important, or equally or sometimes more important than statistical significance. That is, this tells us that whatever difference that they have observed between two groups, that one treatment is better or another, or how much that they have got, that difference is the difference is large enough for us to consider clinically worthwhile. The term that they use for this difference is minimal clinical important difference. This basically means what is the minimum improvement or the minimum difference should be there between group for us to consider that the treatment actually produce a clinically worthwhile, useful improvement. So where do we find this MCID value? In some studies, authors discuss it in the method section, or in the sample size calculation, or so you can find that out, and then you can compare whether the difference between the group is equal to or more than the minimum improvement. In case if they have not provided, then you can get this information by searching into the database, that is rehabmeasures.org. This database consists several outcome measures and its MCID value. So you can find out, so from the article you can find out what outcome measure they use, search for the outcome measure and rehab measures, and find out what is the MCID value. Then you will understand whether the between group difference is bigger than the MCID. If it is smaller than the MCID, then results difference is very minimal or negligible. So it is actually not a big difference for us to consider to our patients. In some cases, you may not find MCID values either in article given or in the rehab measures.org. So what can we do in such situation? And there is one simple method we could use. I'm going to explain about how it can be done, which may be useful when you don't have a MCID value for yourself. So this is a simple example I'm using. And keep in mind, in order to calculate this, we must have the entire outcome measure, full version of the outcome measure consisting all the items or questions in it. So I've given a WOMAC scale, one of the common outcome measure used in as a osteoarthritis knee conditions. So if you look at WOMAC scale, it has 24 questions or items, they say. This involves like whether their problem related to sitting, standing and walking, and climbing stairs and so on, stiffness, and there are several items are there consisting of total is 24, and each item the patient's difficulty is scored on a 5-point scale. It is 0 to 4. So 0 means no problem, 1 means mild, and 2 means moderate difficulty, 3 means moderate difficulty, 4 means severe difficulty, and 5 means extreme difficulty. So total score for this scale ranges from 0 to 96. That is, if a patient is not having any difficulty in all the 24 items, then they will score 0. Or if a patient, if you are having extreme difficulty in all the questions, they will score 24 into 4 will be 96. So with that, we can consider a 1-point difference per item as a minimum difference. That is, if a patient or your patient is having a problem in which if they are scoring for an item as severe, so after treatment, a patient at the minimum would expect to move from severe to moderate, or if they're already in moderate, they expect an improvement moderate to a mild. So these difference from one point to another point, since it's a the difference between each point is 1 point, so we can consider that 1 point difference as a minimum difference. So 1 point per item. So you have 24 items. So 24 into 1, 24 points. So for a treatment to be considered worthwhile, using a WOMAC scale, minimum of 24 points different should be there for us to consider a treatment is clinically significant. Right? Keep in mind, this is an arbitrary method to calculate MCID, not the the ideal way of doing it, but you can consider using it when there is no other information is available. The next part in critiquing results is generalization, meaning how far the study results can be generalized to our setting, to our patients. 3 things you can look into. There are many things actually, but I have identified 3 major things that may be more important than the other. They are a confidence interval, patient characteristics, and setting and feasibility. Confidence interval is a statistical measure. It is usually given as a range. That is, it has a lower limit and an upper limit. What confidence interval means is that these results, that is between group difference that they found in the study results, right? When you apply that treatment in your patient in a larger population, will the same, what would be the difference that we will see in our patient? In study, they have found a particular difference, and when you're applied in your patient, it is very likely that you may not get exactly the same difference in your patient. But so therefore, the confidence interval gives a range of value that you might get in your patient or in another study population. So that range of values in a general population or in your patient should be narrow. If it is narrow, this means that the study results are more consistent, that you're likely to reproduce more or less same or very close to the difference that they have found it in a study. Right? And also the lower limit of the uh, confidence interval has to be closer to the MCID, so that you can be very confident that if you apply the treatment, what they have tested in the study, that you are likely to get more or less same results and also clinically worthwhile results in your patient also. So this is very critical to the initial clinical question that we have asked. So confidence interval plays a major role in our when we want to generalize the study results to our patient. Second thing, patient characteristics. Whether the characteristics of the patient they used in the study are same as your patient. That is the some of the characteristics that we can look into is age, disease severity, disease duration, and so on. So if the your patient characteristics, that is your patient age group or study or disease duration severity, is very different from the one that they have included in the study, then generalization you have to use your judgment whether how far it could be generalized. But this should be looked into. The last thing is setting and feasibility. Which setting it was given, or was it given as an outpatient department or in a home department? Whether the particular treatment that they have tested is feasible here. They have tested a new treatment that requires training, or it is cost is very high. Even though that treatment is effective, if it's not feasible in our setting, right? These issues should be discussed before generalizing study results, because we cannot be. It's not sensible to apply a study results without considering these factors. Finally, you will conclude your presentation by restating what the author's conclusions were and what are your conclusion after critically appraising. And you will be surprised in many circumstances. This may be different. That what the authors concluded may be different from your conclusion, because you have looked into the study more critically and considering the bias involved, considering how they interpreted the study results and how the results can be generalizable. Based upon this, your conclusions may be fairly different, or in some cases completely opposite also, than from what the authors concluded. And also that certain studies will be entirely applicable to our settings. So the point that I'm trying to make is we do not have to simply subscribe to the author's conclusion. Our conclusion should be based upon the critical appraisal, what their study quality of their design, results what they have got, and generalizability of the study results to your patient. And finally, you have to provide a personal perspective on how, what do you think, because it is your patient that you have raised a question and how far it is applicable. And finally, it's better if you are a little provocative and raise certain controversial issues, just that so that the audience are likely to participate more. So that would be the overall presentation contents. And finally, to make your journal club interesting, if you choose a good study, what I mean by good study is a study that address a clinically relevant issues and published in a decent journal. If you're getting so that would make it better. And also, journal club, you have to keep it short. My suggestion would be that if you finish it in 10 to 15 minutes, the attention span could be maintained. And like I said before, you have to raise issues. And finally, there has to be some fun put into it. Otherwise, this would become a very academic exercise. Hope I have explained as much as I could within this brief presentation. And good luck with your General Club presentations. And if you have more questions, I've provided my contact details. You can contact me. Thanks for listening.